Thank you so much. I hope you can hear me.
Yes, we can hear you.
Yes, good morning, everybody, and thank you so much for those who have joined us today as we commemorate this very important week. As mentioned, my name is Dr. Lilian Bao, the CEO of Kenya Cardiac Society, but also a member of the NCDAC board, where I hold the position of secretary, and I'll be giving opening remarks on behalf of the NCD Alliance board. I wish to acknowledge the presence of our chair, the NCDAC board.
Yep. Hey.
That is Dr. Zipporah Ali, who will be addressing us later in this session. I also wish to acknowledge the presence of Dr. Ephantus Mare from the Ministry of Health. We continue to have good collaborations with the Ministry of Health, which is very critical in the fight against NCDs. I also acknowledge the presence of Dr. Mary Nyamongo, and last but not least, John Gikonya, who will be bringing to us the perspective of the people living with NCDs, again, which is very critical if we are to make any progress. So as NCD Alliance, we're excited to be hosting this webinar to commemorate the Global Week of Action 2021, where we are focusing on meaningful involvement of all players and also taking stock on the progress we have made so far. For those who may not know NCDAC well, we are a national umbrella body for all organizations, that is patient groups, NGOs, CBOs, professional associations who are involved in advocacy, prevention, control, care, and rehabilitation of people living with NCDs. Therefore, together, bringing all these people together, we seek to address the rising burden of NCDs in Kenya. And that's, I think, a very critical role. So every year, as I said, we come together during this week, more importantly, to assess the progress made, and secondly, to see how we can continue to combine our efforts to reduce the burden of NCDs. So this year, our focus is people, participation, and progress. So the critical question we need to ask ourselves is, have we made progress? So between last year and this year, have we made progress to address NCDs? How much progress have we made? Is it enough? Is it enough? And what can we do to accelerate this progress? So as NCD Alliance, we will be sharing some of our recommendations through our various presentations on what is the current status, how can we strengthen the efforts as government, as civil society, as people living with NCDs, and as a community in general. We do acknowledge that great strides have been made, but we have very critical gaps which remain. Issues of access to affordable medication. That's a very glaring gap which continues to affect our people. We are looking at issues of the UHC initiative. Are NCDs well catered for in this initiative? Those are conversations we'll be having later in this meeting. And we also acknowledge that civil society, ourselves, and people living with NCDs have been involved in NCD planning and prioritization. But I think we do believe more, there's still more that can be done. And we'll also be sharing that later in the meeting. As NCD Alliance, one of the critical items I've mentioned that we focus on is the issue of the UHC and how we can ensure NCDs is well catered for. I think the UHC initiative promises access to all Kenyans, access to essential health services affordably without posing financial catastrophe. But the question is, have we adequately catered for NCD prevention, treatment, rehabilitation, palliative care? Does the UHC package adequately cater for these services? And this continues to be a huge focus for us, and we'll be hearing more about this later in the session. So on behalf of the NCD Alliance board, I wish to appreciate you all once again, participants and panelists, and I believe we are going to have a fruitful discussion. So thank you so much. I'm going to hand over back to Modoni Mate, our moderator for the session. Thank you.
Good morning all, and hope you have a beautiful morning today. Thank you so much for joining us for this conference. We appreciate the time that you've taken. Just to start off meeting. Thank you, Dr. Lillian, for the amazing introduction. We know that the annual Global Week for Action on NCD seeks to ensure that NCD prevention and care gets the attention and action that it deserves everywhere and including everybody. This year, we are uniting under the theme of community engagement, where we are able to leverage the power and potential of communities to co-create healthier societies and highlight the progress that has been done and the gains that have been made through advocacy efforts in our country, using people's participation, everybody being involved. So thank you very much for a lovely introduction, and just we'll kick off with the head of the NCD, the Division of NCD Prevention, Dr. Ephantus Mare, who's going to walk us through the topic on the NCD strategy and involvement and meaningful involvement. Karibu sana, Dr. Mate. Dr. Mare.
Thank you very much, Muhoni. I'm going to take you through the NCD strategic plan and also involvement of people living with NCDs. Maybe during my presentation, you will not be able to have video because I think my gadget has some issues with the camera. And therefore, I'm sure you'll be contented, and I request you to be contented with my voice, because the most important thing is the presentation. So for today, the first part of it, I'll take you the National Strategic Plan for the Prevention and Control of Non-Communicable Diseases 2021-2022. As you are aware, this is a document which we were able to launch last month, in July 27th. But maybe before I go through the document, let me take this opportunity to appreciate all those who have been involved in this organizing for this webinar, and also these global action activities. I really want to recognize the role played by NCDAC, not only for these activities, but in prevention and control of NCDs in this country in general. They are very good partners. We work very closely with them. And it is my hope that we shall continue enjoying this very good collaboration and partnership. Having said that, I want to quickly go back to my presentation, and I request Catherine to move to the next slide. Catherine, can you get me? Next slide, please. Thank you very much. Before maybe I take you through the NCD Strategic Plan 2021 to 2026, I want maybe to just ask a few things as far as NCD is concerned, maybe to remind ourselves. I know most of us are aware of these things. The overall mortality due to NCD by 2019, it stood at 39%. As we speak today, from our Kenya Health Information System, overall mortality due to NCD stands at around 42.8%. So the figures are rising, and hence the need for us to halt this. Hospital mortality associated with NCD is 42%. I think I've already indicated that. Cardiovascular diseases accounts for 12.7% of all mortalities. Then, of course, we're also concerned about the annual incidence of cancer and annual mortality. Among all the NCDs, I think it is only in the field of cancer where we are now observing some reduction in terms of the incidence and mortality, and this is something we should be proud of. And definitely this is due to great investment we have done. The national prevalence, according to Stepwise Survey 2015, for diabetes is 1.9. And of course, mortality due to injury stands at 7%. Next slide. Next, Catherine, can we try to move a bit fast? Very good. I'm sure we are all aware of the risk factors within our country. And it is obvious that obesity and overweight account for 27% of all the adults in this country. And then a quarter of our adult population has hypertension. and slightly over half of our community has not been tested for hypertension. That is as per 2015 stepwise survey, but I want to believe we have done a lot since then, and we are really working hard to make sure that we conduct another survey so that we can know where we stand at today. Tobacco use by then stood at 13.3%, and alcohol consumption, that is 19.6%. These are some of the risk factors which we need to address and have been heavily addressed in the strategic plan. Next slide. Very good. What were the rationales for the national strategic plan? Why did we have to develop this strategic plan? For one, it is common knowledge that the previous strategic plan, which was running from 2015 to 2020, had come to an end, and therefore the need for us to develop another strategic plan, which will provide guidance to all stakeholders in NCD prevention and control. So this is a document for us all, which will guide us on where to move from now up to 2026. Of course, it is obvious that NCD continue to be a major public health concern and hence needs to prioritize NCDs and give them the necessary attention. Investing in NCDs has been proven to contribute to reduce health care costs and increase economic development. Tackling NCDs is vital to achieving 2030 SDGs. Otherwise, if we do not address the NCDs, we are bound not to achieve the SDGs. And this is in alignment with the Global Action Plan for NCDs, also in line with attainment of Vision 2030 and other global and national commitments. This strategy aims at addressing the gaps and recommendations identified during the evaluation of the previous strategic plan. Maybe just to quickly mention what we realized when we did the evaluation of the previous strategic plan was that when we look at what we had intended to achieve, we had only achieved 17.4% of all those activities we had planned to conduct. For those activities we have partially achieved were 68.8%, and are hoping that 13% we had achieved nothing. However, of importance to note was that in the previous strategic plan, we had no target or indicator. But now this strategic plan has very well outlined targets and indicator, which we shall be evaluating periodically to know where we are heading. Unlike in the previous one, the previous strategic plan had 10 objectives and 109 activities. Those activities we felt there were too many, and we did not have dedicated targets for them. Likewise, the previous strategic plan had not addressed the issue of children and adolescents, neither had it clearly brought up the role of persons living in NCDs and how they were to be meaningfully involved in management of NCDs in this country. This strategic plan has carefully and deliberately addressed that issue. Next slide. Next. Very good. What are our guiding principles in the strategic plan? We shall be guided by quite a number of principles, which include equity. We have to make sure that the services we offer are based on equity, universal coverage, right-based, human right-based approaches, multi-sectoral approach. And if you look carefully at our mission statement, we are talking of halting and reversing NCDs in this country through multi-sectoral approach, and the partnership. Therefore, this tells us how much we are valuing multi-sectoral approach and partnership. We also, this document, one of the guiding principles is also based on life course approach, where we want to look at the human life in a holistic manner. I've just had me say that in the previous strategic plan, we had not addressed the issues of NCD in children, NCDs in adolescents, and all that. So this document takes care of that. It is also a people-centered. It also gives a people-centered approach where we involve everybody. And when we talk of people-centered approach, it means of persons living with NCDs, the caregivers, the policymakers, name it. It also heavily borrows in primary health care approach, whereby we need to give service starting from that very low level where our community lives. We also really value integrity and accountability. Gender responsiveness is highly valued and has been considered in this document, not forgetting innovation and technology. Without that, and I think this has come out very well in the COVID-19 pandemic, I think we may not do very well. Next, please. What is the scope? What are we addressing in this strategic plan? As you are aware, there are quite a number of NCDs conditions which we are giving priority. I'm not going, I may not go through all of them. From cardiovascular diseases to oral diseases and conditions, it's quite a whole scope of NCD conditions, including those rare NCD diseases. Let's move to the next one. I think that is, we can see for ourselves. Good. That is also the scope of the risk factors. As you know, we have been majorly dwelling on 4 to 5 risk factors. This time around, you can see we are now dwelling on 7 risk factors ranging from tobacco use, harmful use of alcohol, unhealthy diet and toxin, physical inactivity. We are now talking of indoor air pollution, exposure to environment pollutants and toxins. You know, we are consuming a lot of toxins and all that. And again, we cannot forget mental health. Stress is a risk factor. We are all aware what is happening with our society, particularly the youth, but when it comes to stress and mental health issues. These issues are well addressed in this strategic plan. Next slide. Great. As far as our strategic plan is concerned, we have identified 5 key pillars to guide us when it comes to investment in the investment areas in terms of managing NCDs. And one of the key pillars we are really looking at is governance and the multi-sectoral coordination. We want to establish a very strong and governance system which embrace all stakeholders, because if we do not embrace all the stakeholders and their involvement, we may not go very far when it comes to halting and reversing the trends of NCDs in this country. The other key pillar we are addressing in this strategic plan as an investment area is on areas of risk factors, modifiable risk factors, where we want to modify them. I've just mentioned those, the scope of the risk factors, and hence I may not necessarily repeat that. We also want to address the issues of health system, so that whatever health system we have can adequately be able to cater for the NCD's needs in this country. We want to really make sure that we really strengthen our healthcare system. We also want to strengthen advocacy, communication, and social mobilization. We want to bring everyone on board, ranging from the technocrats to the media. This is a war or a battle which we must all join hands to make sure that we win. And therefore, the needs of all inclusivity in this area. Most important, we may also have, particularly in the last strategic plan, we may have forgotten the issues of monitoring and evaluation, surveillance, and all that. And therefore, in this strategic plan, we are really going to invest on that to make sure that we are able to monitor our activities and take appropriate actions and as we implement this strategic plan. Next, please. Thank you. Now, as we implement this strategic plan in the next 5 years, definitely one of the advantages we have as far as this strategic plan is concerned is that the strategic plan is costed, and therefore we know the resources we need in order to get where we want to be. In order for us to have a nation free of preventable NCD burden, we have really tried to look at the cost. And in the next 5 years, we need around 377 billion to adequately address the issues of NCDs in this country. When we look at what is available in this country for for funding NCD's activity. It is only a part 6%, and therefore that's totals to about 20 billion. And this is from all the sectors, that is. And therefore, creating a huge gap of 94%, or in other words, 356 billion. And therefore, we have a huge task ahead of us to mobilize resources and to make sure that whatever we have, we use it very effectively and efficiently. Next. Great. So I think that is just, that slide is reminding us, in order for us to achieve what we intend to achieve, to halt and reverse the NCD burden in this country, we must bring together our resources. We must work as a team. We must create a very conducive and strong institutional framework to enable us to get there. Next one, please. Great. And this is just a continuation of that, showing that all the stakeholders we need to bring on board, particularly all the government sectors, national and county government, individual and communities. And this is now where we are talking of even persons living with NCDs. We need to bring together the academia, the media. That is where now we have to do a lot of advocacy and awareness creation, private sector, faith-based development partners, including even the lawmakers, to help us put very elaborate laws and regulations to make sure that we are able particularly to address the risk factors. Next, please. Let me now come to the next part of my presentation, and this now touches on involvement of persons living with NCDs in the ministry. And I would want to say that as a ministry, we have really embraced working with partners, and we have not left out persons living with NCDs. We have tried as much as possible to involve them in all our activities. I know we get in touch with them. Our offices are always open for them to come and discuss with them. And I know quite a number have joined us, and we have initiated very, very productive programs and activities within the scope of NCDs. And I think this is quite encouraging. And we are really proud and happy about this. Let's move to the next slide, please. Thank you very much. As far as coordination is concerned, how have we involved persons living with NCDs? We would want to say that we have incorporated persons living with NCDs in our national NCD ICC committee. And this is the highest organ when it comes to prevention and control of NCDs in this country. And people living with NCDs have representation up to that level. And this is quite interesting and very encouraging. And we are very happy that we are able to work with them as a team. People living with NCDs are also involved in various technical working groups. I do not say, we have quite a number of TWGs for the NCD ICC. And I want to allude that in almost, not almost, in all those TWGs, we have a person living with NCD, at least in all the TWGs. We have also incorporated the decisions and the interventions of persons living in the NCDs when it comes to policy development. And we endeavor to continue doing this and as a ministry. And I want to allude to the fact that I'm happy that wherever we are making a policy decision or a strategic decision, people living with NCDs are always involved, and they have been very actively participating in that. Next slide, please. This is a continuation of how we involve them in policy making. I'll quickly go through this. As earlier indicated, we have consistently involved them in development of NCD strategy. A good example is when we were developing the strategy, which I was just presenting to you. We were able to involve persons living with NCDs throughout that strategy. Again, when we were developing the National Cancer Control Strategy, We were able to involve persons living with NCDs very actively. And also when developing other strategic and policy document, we have also been able to involve them very, very heavily, particularly when it comes to development of guidelines. And particularly one of the very, very interesting thing to note is that during the COVID-19 pandemic, which is still ongoing, we had issues with the provision of services, particularly for people, for our NCD clients. And we had to come up with strategies of making sure that our persons living with NCDs are well catered for during the pandemic, particularly those very early days when the clinics were closing down and all that. We were able to come together and contribute very, very positively to the management of persons living with NCDs. And I want to believe today there is no persons living with NCD who is not receiving service because simply there is a COVID-19 pandemic. And this is something we should be proud of as a nation. Well, let's move to the next slide, please. As I was saying earlier, persons living in the NCDs, of course, have been involved in the development of clinical guidelines. That is straightforward. Further, MOH has also been working with people living in diabetes, and a good example is like we have KDDA. They are some of our key stakeholders when it comes to management of diabetes. We have also involved, engaged people living with NCDs, particularly when it comes to selection of community health volunteers and peer educators. A very good example of this is what is happening in some counties like Makueni, where we have peer educators taking charge in terms of managing and guiding their fellow persons living with NCDs when it comes to the management of their own conditions. And this has worked very, very well. So other areas where we have been able to use persons living with NCDs is particularly like when it comes to the issues of commodity availability. We have really resonated very well, and we have always gotten input from persons, the organizations of persons living with NCDs. A good example is the organization which Gikonyo belongs to, the Reno Association of Kenya, whereby they had issues with medications for renal patients, and we actively involved them in a discussion with KEMSA, KNH, and other health facilities to make sure that the commodities are available. And we continue to have these very healthy discussions with persons living with the NCDs in various other fields of sickle cell disease, fields of hemophilia, fields of cancer, diabetes, and all that. And this is quite good. Next slide, please. Very good. When it comes to advocacy, particularly when it comes to marking World Health Days, and we have quite a number of World Health Days when it comes to NCD, I do not think we have ever marked any World Health Day without involvement of a person living with the NCDs of the concerned health day. I know, like when we are dealing with World Health Day on cancer, we normally bring cancer survivors to give their testimonies. And I also know when we're launching our strategic documents, we also bring persons living with NCDs to give their testimonies in terms of the document we are launching, whether they have been involved, how much the document will be used to make sure that we provide better services. So I think as a ministry, we have strongly and really encouraged persons live with NCDs to work closely with us, and we have really seen what they can do, because when we use them, they normally talk with a lot of passion. They share their experience to the others. Another good example is like when we hold camps for the diabetes, children with diabetes. I have been able to at least experience children share their experiences. And some of them come to learn, Kumbe, I'm not the only one. I'm not the only child with these conditions. There are many others. And they are able that way to network and be able to share their experiences and live very, very positively. Next slide, please. I think that is all. Maybe hope we shall have some more times, maybe during the subsequent forums to discuss this. As a minister, let me once again reiterate, we are very, very happy to be associated with NCDAC and all other partners in the field of NCD. Asanteni sana.
Thank you very much, Dr. Ephantus Mara, for a very, very comprehensive update on the strategic plans and meaningful engagement of people living with NCDs, where the people living with NCDs are represented and have active participation in not only decision making, but also in service delivery, advocacy, and social mobilization. I can testify that this is something that your door is always open for people living with NCDs, and your office is always available to work together with people living with NCDs. So asante sana for that. We will jump to the next speaker, who is John Gikonyo, who is a person living with an NCD and the founder of Renal Association of Kenya. He's very active in advocacy and bringing together other people living with NCDs. He's going to talk to us. He's going to give us his testimony on what it means to have been involved meaningfully in the work that he does. Karibu sana Gikonyo.
Thank you very much, Modoni. I'm very excited because my work has been very comprehensively covered by Dr. Murray in the last bit of his presentation. I think he has captured the whole spectrum of the meaningful engagement between persons living with NCDs and the Ministry of Health. And I'm here to be a testimony that yes, we have been engaged and involved in decision making between ourselves and Ministry of Health through the kind assistance of the NCD Alliance of Kenya, which has been a very useful facilitator of this operation. Particularly in the era of the COVID-19 pandemic, I think I've seen a lot of involvement and engagement with the ministry. I remember when the COVID-19 protocols were rolled out early last year, and there was a lot of confusion, and we ended up with closed clinics. We ended up with sometimes dialysis patients not being able to cross barriers to get to their renal units. And we were able to quickly resolve these bottlenecks because at that time we had been incorporated in a COVID-19 subcommittee that the Ministry of Health NCD division had formed. So we were able to engage quickly, discuss, and find solutions to some of these problems. We did participate in the task force that worked on the national strategy for NCDs that was launched in July this year, and we sent representatives there, and we are happy to see our input, and we are looking forward to working along with all the players and actors in the implementation of this national strategy. It's a bit doubting to see that we only have 6% of the funds available, but we have 5 years to look for these funds. So I'm sure in this time we should also look for innovative methods of finding ways of funding this strategy. One area of importance when it comes to meaningful involvement, which I would like to touch on, is the issue of feedback. Because when we interact with the ministry, when we interact with health caregivers and providers outside of the clinic, when I go to the clinic and I leave 10 people waiting, I spend about 10 minutes with my doctor, and I am paying for this time, so I can only be in so many clinics at a certain time. So there is really very little interaction besides these are the symptoms and here is the prescription. That's all you can do in a clinic. But outside of the clinic, where we are able to interact, we find very good opportunities for honest interactions. And the most important aspect of that is the feedback that we are able to give to the healthcare providers, to the ministry, to the policymakers, and tell them how the policies that have been rolled out are affecting us, where the shoe is pinching, what we would like increased, what we would like relaxed, etc. An example I would like to give is the wonderful NHIF coverage for renal patients who are on dialysis. Dialysis patients in Kenya today do not spend money out of pocket because it is fully covered by NHIF at a cost of 1 million shillings per patient per year. And that is a beautiful thing. A lot of people who are on dialysis today would not be alive without this very useful intervention by the government and the National Health Insurance Fund. But we also notice that because the patients are not spending money out of pocket, they are reluctant to progress to a transplant, which would give them a better quality of life because NHIF does not cover post-transplant medication, which are expensive. So I feel I would rather stay on dialysis where I'm not spending anything than go to transplant where I will be required to spend some money. The irony is, on dialysis, I'm costing NHIF 1 million. If they put me on post-transplant meds, it will cost them about 400,000 a year. So it would be a much better outcome for both NHIF and myself as a patient if I am on transplant, because I will be enjoying a better quality of life. NHIF will be saving a whole 600,000, which they can spend on another patient. So we would like to give this kind of feedback to NHIF. Yes, we have received this service, but we can improve it by doing 1, 2. Again, there are patients who are unable to access transplant because there is no coverage of post-transplant evaluations and tests that ones need to do that can cost up to 200,000 shillings before somebody is able to get a transplant. People who cannot afford this amount cannot be able to take advantage of the 500,000 shillings that NHIF covers for transplant. So we need to interact, we need to engage so that we can be able to give this kind of feedback and come up with now solutions and strategies that are beneficial to both parties or to all parties involved. I would like to thank the NCD Alliance of Kenya. Like I said, there have been an integral link between ourselves, that is the caucus of patient-led organizations and persons living with NCDs, and the networks that are involved with, involved in the management, control, and all decisions to do with management and control of NCDs. I don't think we would be where we are, even with the Ministry of Health, without the intervention of NCD. So asante sana NCD, and we hope that this cooperation will continue and that we will be able to continue working together towards an NCD-free Kenya. Dr. Mare and your team, again, we are very happy for the cooperation that we have had up to this point. I think in my advocacy work, I have seen a lot of engagement in the last 2 years, especially during this pandemic. The reason being that I have been at your doors because of the problems that, or the havoc that COVID-19 has wreaked on some of, or most of the people living with NCDs. And like I said, we have been able to come up with some solutions to that. We look forward to better cooperation. The strategy has been launched. It needs to be implemented. It needs to be worked on. We need to hold one another responsible. And we also, as persons living with NCDs, we commit to align our activities and all our advocacy plans and the strategy, so that what we are doing and what the ministry is working on will be in harmony. So thank you very much, and we do look forward to having a very good cooperation going forward. Now, as a caucus of patient-led organizations, we would like to issue at this point a press statement, which I would like to ask Munaji to please put on the screen. Okay, I think I will read from my small screen here. And this is a press release statement for immediate release, released today in Nairobi on September 9, 2021. And our message is prioritize NCDs and meaningfully involve people living with non-communicable diseases in Kenya's NCD response. And we, the people living with non-communicable diseases in Kenya, call on to the government to put the people living with NCDs first through active, meaningful involvement in Kenya's NCD response and universal health coverage UHC program. 2, request the Ministry of Health to increase public awareness on the COVID-19 vaccine and build vaccine trust for public acceptance. And 3, call upon the Ministry of Labor and Social Protection to consider and count persons living with NCDs as vulnerable population for inclusion in the cash transfer benefit program. We, the people living with non-communicable diseases in Kenya, commend the government of Kenya for the inclusion of persons living with NCDs in the current national COVID-19 vaccination campaign program.
Sorry, Kikonyo, we seem to have lost you. Hello?
Okay, sorry about that. And just to save time, I will not go through the whole statement, but we are basically calling upon the government to continue putting persons living with NCDs in the center of all the interventions against NCDs, and particularly this period when we are going through a pandemic. We have now COVID-19 vaccination, which we encourage persons living with NCDs to please get vaccinated. We would like the government to set out very strong messages against those people who are spreading false information about the NCDs, about the vaccines. The vaccines are safe. A lot of us living with NCDs, including myself, have been vaccinated. I have had no side effects and I am fine. So we want to ask the government, please bolden these messages, encourage the population to get vaccinated. We will come in and validate these messages with our own lived experiences and personal evidences. And we hope that all people who are due for vaccination will be vaccinated, and that the 10 million vaccinated people goal by December this year will be reached. What I would like to add the ministry, probably through Dr. Mare, is that one is a way of getting people living with NCDs to be vaccinated in an environment that they trust and they have confidence, is to take the vaccines in their clinics. For example, if we took vaccines to all the renal units, I'm sure within a week, where renal patients visit twice a week, all dialysis patients can be vaccinated within a week. So some of these, and if they get the vaccine in a place where they visit every week, where they get their relief, they will not have issues with the vaccine. So we encourage, if that could be done, we will be able to, again, achieve the 10 million vaccinated people by the end of this year. So we will circulate this press release to our media partners after this, and then they will be able to disseminate it through the media channels. So thank you very much. In the interest of time, let me end there, and so that we have more presenters. Thank you.
Thank you very much, Banagikonyo, and thank you for just showing a classic example of what multi-sectorial partnerships look like, where there's meaningful engagement of people living with NCDs, and gone are the days where people living with NCDs were passive victims of their situations. Now they have become a force to reckon with. They are active participants. They are literally frontline in terms of innovation, in terms of the information that they can be able to provide. And thank you for being able to give us an example of what you have been involved in. Just a question, just a comment to the audience. We have amazing speakers, we have amazing participants and people in this particular webinar. So post your questions. This is a one chance that you have to have that burning question be answered today. Let us get all that in the comment section. We'll be able to pick them out and have a feedback Q&A session at the end of this. Banagikonyo, if you could please post the press statement in the various NCD Alliance social media platforms, and also share those links with them. Thank you. Our next speaker is Dr. Zipporah Ali, who is the current chair of the Non-Communicable Disease Alliance Kenya chapter, and her topic today is going to be on CSO involvement and Global Charter Report. Karibu,
Then you're
Sana.
frozen.
Can you hear me?
Yes, I can hear you. Can you hear me,
Yes.
Mudhoni?
Yes, we can. Karibu, Sana.
Well, thank you very much, Mudhoni, for the introduction, and thank you very much the previous speakers, Dr. Mare, Dr. Lillian, and Mr. Gikonyo. Mr. Gikonyo, you are always very impressive. I really wish that we will work as NCD Alliance to ensure that every person, including myself, living with an NCD, is that vocal, is that confident, is that stubborn, because I find you very, when I say stubborn, it's not negative. I find there's that passion in you that tries to ensure what you're fighting for is actually achieved. I really want to welcome all of you as the chair of the NCD Alliance to this webinar. I know you've been welcomed already, but I would like to add my welcome to Dr. Lillian Balu's welcome. Thank you very much for sparing time to come and join us this morning. Thank you to the panelists for also sparing their time to come and join us this morning. This is a very important week for us. We are now celebrating the Global Week on Actions and NCDs, and I'm glad that most of you are very active in this. I've been seeing posts on Twitter and other platforms, and that's very engaging. Thank you very much for that. I will be presenting a report that I helped NCD Alliance of Kenya do some time back before I actually became the chair. And it's a long report. That one of them is a long report, one is a very small report. So it will not be possible for us to really address everything in the report in this presentation. The full reports will later on be shared by the NCD Alliance with all the members, and you can read the reports. Most of you were part of the focus group discussions or were interviewed personally in in-depth interviews. So you might not see maybe what you mentioned here because it's a very short time to address all the things that came out in the report, but everything that you talked about was captured in the actual reports. So we hope that the reports will be well presented to everybody in full. But I'll share briefly what we found in the reports that we hope will also help you understand how we need to be engaging in NCDs as people living with NCDs. I'm a person living with an NCD, so when I talk about people living in NCDs, I'm talking about myself as well. I'll put off my video and ask Catherine to share the screen. I'll put my video so that at least I don't have connectivity issues. So yes, I'll be presenting two reports. One is the Civil Society Involvement Status Report, promoting prioritization of NCDs prevention and control and UHC in Kenya. And the other one is a very short report that we did to gather information that was going to contribute to the Global Charter on meaningful involvement of people living with NCDs. And this has already been captured and out on the website of the NCD Alliance. You can read it from there. I've actually put the links of the website to some of these documents. Next slide, please. So the Civil Society Involvement Status Report was a very engaging process. The report addresses the NCD Alliance's progress in meeting its program activities and its vision through the meaningful involvement of people living in NCDs, civil societies, patient-led organizations, and other relevant stakeholders. We really wanted to hear about the progress that people who are living with NCDs have actually seen or have made themselves. And NCD Alliance has been bringing these people together. They have also been coming together within their own patient-led organizations, civil society, to actually address the burden of NCDs. So it also outlines the progress that Kenya as a country has made on reducing the burden of NCDs in the country. And Dr. Murray has already shared what the ministry is doing, what the government is doing. In this report, actually, it was very, very clear that the government is doing a lot to address NCDs. It's a lot better than what it was 10 years ago. And if you finally get to see the full report, there's a whole table that has what I call a scorecard that has looked at what has our government done. For example, is our NCDs a priority? Do you have guidelines? Do you have strategies? Do you have policies? Are we addressing the issues of tobacco, alcohol, environmental issues, lifestyles, physical activity? All these things have actually been addressed in many documents by the government. They are in the strategic plan, national strategic plan, they're in the health policy, and many, many documents. The only thing that, of course, we need now to focus on, apart from being on paper, are they being implemented? Are there programs that are addressing the things that have been mentioned in the whole report? So again, that was one of the challenges we came across. So Kenya is an NCD Alliance, the NCDAC, recognized the 2018 Political Declaration on NCDs and the 2019 Political Declaration on Universal Health Cover. Both recognize the role of civil society, people living with NCDs, communities in the NCDs, and UHC response. So again, we are a member of the global response to NCDs, and we are signatories to all the necessary declarations as a country. So really, we need to be able to ensure that we implement what we have signed for. We don't just sign things on paper and leave them there, but that we implement what we have signed for. So again, the next slide, please. When we were looking at this report, we did a lot of literature review. I did a lot of literature review, actually, just to understand what is happening globally and also what is happening in our own country. Looked at existing guidelines, strategies, frameworks. Like I said, I realized there were so many things that actually have been put on paper in this country regarding NCDs. So it's not really that the government has not prioritized. They have prioritized, but because of probably because of resources, financial resources, human resources, and also because of weak or broken health systems, that we are not able to actualize what we have put on paper. So we looked at the literature review. We interviewed people living with NCDs, patient-led organizations, civil societies, and other key stakeholders, and of course, key policymakers to be able to come up with this report. A few documents were very useful in this report. One of them was Pushing Progress on NCDs. That is a toolkit for civil society-led accountability actions to bridge the gap between commitments, targets, and results. Was very keen in addressing, in helping come up with this report, coming up with the actually questionnaires or question guides for the focus group discussions and for the in-depth interviews that we conducted. And also the other document also is Our Views, Our Voices, meaningful involvement of people living with NCDs. There's the global one, but also there's the Kenya. We also have the advocacy agenda for people living with NCDs, our own Kenyan advocacy agenda for people living with NCDs that was also very resourceful. We would like, as NCD Alliance, to acknowledge all those who are part of this process. those who those who took part in the interviews, the focus group discussions, the in-depth interviews, those who at the secretariat who worked to bring the focus group discussion people together, and of course all the people who are fighting to address the burden of NCDs in this country. What we did is we interviewed people and recorded the interviews, and then we did transcripts of the recordings of the interviews. It was a bit challenging because we started in English. A lot of times, a lot of Kiswahili came in, but we're able to also transcribe that. And then, of course, write a report that is mostly focusing on reporting what people said, the quotes from the participants, because I think it's very important to capture what a person says from deep inside their heart. So it was really more of like a qualitative approach rather than a quantitative approach. The focus group discussions were, all the interviews actually, whether they were focus group discussions or in-depth, were done virtually because of the COVID situation. Of course, we had those limitations. If we had done a face-to-face, focus group discussion or interviews, we'd probably have gotten more engagement from the participants. People had connectivity issues. They kept on dropping in, dropping out. So it was also a bit challenging. And of course, getting appointment to get people to come on a virtual focus group discussion or in-depth interviews was a bit challenging. But finally, we're able to do the interviews and get the information that we put down into the report. So just a few findings. As I said, the whole report will be made available to you and you can read from the report. It will be more comprehensive. One of the things we looked at was access to health services, including prevention, promotion, screening, diagnosis, treatment, and care, rehabilitation, palliative care for people living with NCDs. Now, Dr. Murray has also spoken about the same issues. The government is trying to address the issues of the burden of NCDs right from prevention. We have things like the tobacco legislation. We have guidelines on alcohol, even the sale of alcohol, not selling alcohol to children and all those young people. We have all those things that have been put in place to address to actually focus on the prevention. But we also have the government also putting healthcare systems that can actually provide healthcare services for people living with NCDs. So people living with NCDs still face challenges from what we gathered from the interviews in accessing comprehensive treatment. Many people said they were not able to access their medicines, they were not able to do their lab tests, they needed to travel and all those things to be able to get their treatment. They talked about NHIF and UHC package not fully covering all the costs of diagnosis, treatment, palliation, survivorship, and rehabilitation. So again, and I'm happy that Dr. Nyamongo will be presenting on UHC. I hope she'll talk about NHIF as well, because although we have been told that NHIF covers NCDs, each individual had different experience. Some said, okay, it was paid for. Others said it was never paid for, it wasn't paid for. So again, there are very, very many challenges in terms of accessing treatment for our NCDs. So again, for example, patients who have had a transplant also complained about the fact that post-transplant treatment, for example, a kidney transplant, post-transplant treatment is very costly, about 60 to 70,000 Kenyan shillings per month for maintenance. And some of them feel that this is not well covered by NHI, so they have to struggle to be able to get funding. So at that time, Dr. Jessa Wako was the head of the Department of NCDs. He actually mentioned that the Ministry of Health has done a lot on NCDs. They have now a full Department of Non-Communicable Diseases, which has got 6 divisions in the department. So again, I think having worked in the health sector for many years and having also been very close to the Ministry of Health, actually this is a very big improvement from the time of when Dr. Maina was there. There were 3 or 4 people in one small room. Now there are quite a number of people working in the NCD department, and they also have not only increased the people, but have also increased the different sections in the department. So I think that's a very big plus for the ministry, Dr. Murray. But despite this, also participants felt they still, lose family members due to high costs of post-kidney transplant maintenance. And then again, just like I said earlier on, somebody mentioned earlier on, COVID-19 also has brought a lot of challenges for people living with NCDs. Initially, some of them, for example, cancer patients at the beginning of the lockdown last year were not able to access their treatment because of travel limitations, and also because the hospitals had not really closed, but slowed down to focus on COVID-19. So I think with time we have learned how to handle both COVID-19 and other conditions as well. So despite everything that is being done by the government, still people feel that a lot more could be done to improve access to treatment. In terms of civil society engagement in NCDs, as Dr. Maria mentioned, recently we launched the Ministry of Health. Our country, Kenya, launched the second strategy for non-communicable diseases. The first one that was for 2015 to 2020 did not bring people living with NCDs on board when developing the strategy. They did not particularly bring people working with patient-led organizations or people living with NCDs or into the planning of this strategy. Although members of the team that was involved in the strategy, some of them from the ministry, some of them from WHOs, may be living with NCDs. People felt that that is not a representative of the person on the ground in the community living with an NCD. But then in October 2020, the Ministry of Health held a meeting in Naivasha and brought people living with NCDs who were supported through NCDAC to attend the meeting. And this is also people felt that this was a very good development, that bringing people on board from the very beginning of planning this strategy in 2020. So I think the head of the department at that time, when I talked to him, also said that apart from just bringing people to the strategy, they also have been involving people living with NCDs in a number of technical working groups formed in the Ministry of Health. So they feel that they have involved a lot of civil society, people living with NCDs. And Dr. Maria mentioned that as well, that it's important for the government, the ministry, the counties to involve people living with NCDs in whatever that's being done. And again, just interviewing people, when they say yes, they might call us to a meeting, they might listen to us, they might actually, we'll take part in a meeting, but sometimes they walk out of that meeting feeling that they were called there because it's good to call this people and have them so they don't make noise. But maybe what they said was not captured. What they wanted to be included has not been fully captured at the end of the meeting or the report that comes out. So the issue of tokenism was actually, tokenism is when people might call you to a meeting and not necessarily incorporate what you have put forward. So again, that was something that came out. Other people said that they were happy they had been involved. For example, somebody from Stock Association of Kenya said, I remember last year, in Naivasha drafting the NCD strategic plan, myself and another lady suffering from a renal condition took part in the workshop, and we contributed to the draft of the strategy. We felt valued to be able to contribute to this important document and to make certain decisions that were valued by the Ministry of Health. We are both supported by the NCD Alliance of Kenya to participate in the workshop. So they were ambiguous. Some felt that they were fully engaged, others felt that they were not fully engaged. But I think over time, we are seeing that they are becoming engaged in different in different technical working groups and all the necessary channels that they need to be engaged in. So these pictures might not necessarily, they're not the pictures that I took during these interviews, because like I said, we're doing virtual interviews, but these are pictures that have been taken during different different activities by NCD Alliance of Kenya, of people living with NCDs, patient-led organizations. So these are also important pictures to show that there is engagement of people living with NCDs and what NCD Alliance is doing. So somebody says that I believe, somebody says that I believe it is very important that people living with NCDs, Dr. Evan Jenga was the NCD chair at that time, should take a key role on matters that affect them. She should not just be asked about their opinions, but must be respected and included in whatever they do that affects them. And they should be fully engaged in advocacy and awareness on NCDs. And Makumi, who is the vice chair of the NCD Alliance, talked about meaningful involvement of people living in NCDs being essentially part of any decisions, policies, regulations, guidelines that affect them in one way or another. So again, it's important that we actually have people living with NCDs involved in whatever that we're doing as a country, whether we're developing guidelines or policies from the very beginning, throughout the process, and actually up to the implementation phase, and also the monitoring and evaluation phase, and at the same time also accountability. We actually have to hold our country, our government, whether it's national government or also whether it's county governments, responsible for what they have put down on paper to ensure that it's being implemented. So again, these are just some quotes from many different people. We have Dr. Marie Nyangasi, who talked about the fact that the National Cancer Control Program has engaged people who are cancer survivors or people who are undergoing cancer treatment in what they are doing. They involve them in any documents that whether they're doing for example, the breast cancer documents, they're doing cervical cancer documents, they involve people in these documents. And she also talked about the fact that if initially they would order things, for example, like colostomy bags, and they realized they were ordering the wrong colostomy bags. And so nobody used these colostomy bags. It was a waste. So now what they do is they involve people with, for example, who need colostomy bags to tell them which colostomy bags to bring, which are the ones that people prefer to use. If it's a breast prosthesis, anything that they want to have, they're now involving the people who are survivors or people who have got these conditions to be able to tell them what is the best product to be able to bring to them. And again, we also have people who are living with the conditions, working with some of the departments in the Ministry of Health or even civil society. One of our cancer survivors also talked about the fact that she supports the National Cancer Institute in terms of understanding what people living with cancer need, and to be able to be a representative of people living with cancer in that institute is very important. So they are able to get her views and listen to her voice. So again, it is clear that talking to people living with NCDs, civil societies, and patient-led organizations, there have been several opportunities to involve those directly affected by NCDs, whether developing strategies, guidelines, or policies. And this is again through the NCD Alliance of Kenya, which has invited people to the UHC meetings, NHIF, and other relevant meetings so that their voices can be heard, and so that we can actually bring change. However, it would be challenging to evaluate whether all their views have been incorporated, especially in the country's UHC and NHI basic packages. Sometimes people feel that you go to a meeting, you talk, you meet the cabinet secretary, for example, he listens to you, then he tells you, I will call you back, I will write to you an email, I will let you know when the next UHC meeting or or NHI meetings, but then nothing happens after that. They give you a 2 minutes forum and then nothing happens after that. So you walk away feeling that you may not have achieved anything. So again, it's important that we actually, as our government, that when we sit and talk to people living with NCDs, that we actually take their views seriously. We address their concerns and issues, whether it's access to medicines, whether it's access to laboratory tests, or whether it's access to survivorship. We should be able to engage them and listen to them, and of course now take actions. It's not just a matter of listening. I have personally, with other people, NCD Alliance, and Dr. Lillian knows, gone to the NHI office several times, talked about our issues, presented papers, presented documents, evidence, worked out, and then we're told we'll get back to you. It's now over a year. Nobody has gotten back to us in terms of what we had asked for. So again, those issues still exist. And Dr. Maria, I hope you're still on the call, and Ministry of Health, that we need to actually focus on what we would like to do for the people living with NCDs. So the next slide, please. Next slide, Catherine. Most people felt that it was actually, I did not come across a standalone policy on NCDs. And most participants in this focus group discussion in the interviews felt that if we had a national policy, a standalone policy on NCDs, it might actually improve the situation of the burden of NCDs. They felt that it might actually focus on ensuring the resources at the national government, at the county level, right up to the community to address issues of NCDs, whether it's early detection, prevention, rehabilitation, treatment, and all those things. So they felt that issues on national and government county budgets, human resource, access to quality NCD services, including essential medicinal commodities, would be well addressed through a policy, and that the government would be mandated to prioritize the financing of the prevention and control and care of NCDs. So again, talking to Dr. Wako at that time, he mentioned that the USC package may not include everything, but has included, for example, he mentioned that the common NCDs, for example, diabetes, hypertension, cardiovascular conditions, and some of the common cancers, breast and cervical, it might have included some, services of these conditions, but not every condition has been captured in the USC package. I think, I know that I haven't really seen a USC package for this country that has been presented to anybody to understand what it is. We're still waiting, and I hope that soon we'll be able to get an idea of what it's actually covering. So again, Somebody from the Stock Association of Kenya talked about the inclusion of prevention and control of NCDs, reducing the burden of NCDs should not just be on paper, but should be fully implemented at all levels of care. If it's aimed at ensuring that all in need have access to basic healthcare, then this is what should happen. If NHI covers basic healthcare, then that should do the same. But unfortunately, they said that this is not what's happening, that they do not feel that they are well or fully covered by the NHIF or the USC package in this country. Next, please. So we looked at also the balancing the efforts across the range of NCDs, particularly cancer, diabetes, cardiovascular diseases, and chronic lung diseases. Most participants feel that these are the NCDs that the ministry is concentrating on. Of course, we know that these are the 4 common NCDs that are affecting many Kenyans, but there are many other NCDs apart from this that are affecting many Kenyans. And when I was doing these interviews, I really came across people who are very passionate about what they were going through. You know, somebody with a sleep disorder called narcolepsy talked about her challenges as a person with this disorder. And she just falls asleep in the middle of a conversation. She falls asleep in matatus. She falls asleep, at work. So she cannot even be employed because of that. Somebody with lupus talked about the fact that the treatment for lupus is very expensive. It's a rare disease. Even the stigma around the disease, they mentioned all those things. So again, there are many diseases that have not been captured that need to be captured, this rare disease, because at the end of the day, it's the individual, the person, not the magnitude of the number of that particular NCDs, but the fact that it affects me as an individual. Although it might be a rare disease, I'm affected, it affects my quality of life. So that passion was also there. People felt that we need to address a wider spectrum of NCDs. Interviewing Dr. Gladwell, head of the violence and injuries, she mentioned about the fact the ministry is actually trying to address all the NCDs as much as possible and has developed guidelines on a number of NCDs, including diabetes, cardiovascular diseases, oncology, epilepsy, sickle cell. The sickle cell treatment guidelines were actually launched very recently. Hemophilia, asthma, mental health, and tobacco cessation. So again, the government is trying to address most of these NCDs as much as possible. The NCD Alliance greatly has attempted to include everybody in their as their members, because they don't just focus on the 4 main NCDs, but they also try to bring the rare conditions on board as well. So again, it was felt that more efforts need to be put into the other NCDs apart from the 4 major ones. Next, please. In terms of access to affordable medicines, next. I'm also looking at again, I think it has been mentioned. Dr. Lillian talked about access to medicines, and Mr. Gikonya has talked about that even in the press release. So again, press statement. I think we all know that it's very difficult to access our medications a lot of times. NCDs are chronic conditions. You live with them for the rest of your life, so you actually have to be on treatment for the rest of your life. Again, our USC, as you remember, our president did have 4 big agendas, and one of them was UHC. It was piloted some time back, and a lot of issues. I don't think the pilot was very successful because all those UHC cards are not working in any country right now. But I hope that the government is working in terms of improving whatever it is that didn't work very well, to be able to provide a USC package for Kenyans so that it can address NCDs as well. So again, the head of the department at that time said the National Essential Medicine List of 2020 includes laboratory and many other things. NCDs are covered. It borrows a lot from the Global Essential Medicine List as part of the health system strengthening. The Essential Medicine List describes and lists the necessary essential package, but should be available at the different levels of operations. Again, it's important to note that the Essential Medicine List might actually have the drugs listed, but they are not available. They are not available. Again, that is a challenge. Somebody has actually put on the chart that multiple sclerosis is also neglected. Yes, I might not have mentioned this, but again, I am aware that that is also one of the neglected diseases, and yet there are people who are suffering from it. So we also need to remember that. Again, somebody with a stroke talked about the fact that, after they went to the hospital, they were treated, they were discharged. During the discharge, they were not even told anything about what should happen next. They were told to go to physio, but they didn't know where to go to physiotherapy. It was very difficult for them because it was not covered by NHF. They lost their job. They were not able to pay the 500 shillings for NHF. So again, the issue of patient navigation, where do you go from one place to another? when you're going through treatment is not very well done in this country. Again, so navigation for patients, and again, NHIF cover. If you don't have a current paid up NHIF cover, you're not able to benefit from NHIF. So again, those are some of the things that came out. So people living with NCDs and civil society, patient-led organizations feel that the issue of human rights and accessing their medication and other services for the conditions they live with has not been well explored and implemented. Of course, Kenya is a signatory to human rights, including health rights. We have our health policy, our health law that talks about access to basic healthcare, from prevention, promotion, preventive, curative, treatment, rehabilitative, reproductive, and palliative care. Although this is in paper in the Patients' Rights Health Charter, again, we realize that these are not really, this is not the reality on ground. So much needs to be done, still needs to be done for people to be able to access healthcare services for their NCDs. In terms of civil society participation, there are ways through the advocacy of work of the NCD Alliance Kenya. There has been improvement in the engagement of people living with the NCDs, the patient-led organizations, and civil society. And then again, I've mentioned the issue of tokenism, challenges and gaps that exist for their full participation. They might be called into the meetings, but they're not, whatever they contribute might not be taken on board. And we are told that if you look at our views, our voices document, it talks about full participation. From the time you're doing a policy, you have to invite people on board, so that even when you're doing a work plan, they're also part of that work plan. And when you go to implement this, whatever it is you're putting into a guidance or policy, they should be part of that implementation, and they should be able to hold the government accountable for what is going on. So again, it's not just calling us into a meeting for 2 days, but again, we have to be engaged throughout so that we also know what's going on. Lack of funds, poverty, jobs lost due to the condition also contributed to them not being fully engaged. They might be told to come to a meeting, but they have no fare transport to go to that meeting. You might be told there's a meeting in Naivasha or Machakos, whatever, but you don't have money to take to that meeting. You don't have money to pay for accommodation and all those things. Issues of also, advocacy skills, leadership skills. Although NCD Alliance has tried as much as NCDAC has tried as much as possible to engage people, to train people, people felt that they needed more training. They needed more people to be trained on advocacy, public speaking, and leadership as well, so that they can also be very confident when they're talking, whether at the county level, the national level, or even at the UN level. They should be able to talk about their needs. And I was really impressed by the people I interviewed in this process. Many of them have actually been to the UN, in a number, not many of them, but a number of them have been to the UN level, high-level meetings in New York and spoken there through the NCD Alliance of Kenya. Some have been to Geneva. They have spoken about their needs. And even during this COVID period, quite a number of people in this forum also were invited to be panelists and speakers in quite a number of the webinars that were taking place at the high-level meetings. So again, that is very impressive. So quite a number of things.
Dr. Zipporah, I would ask you to start winding up, please.
Okay, okay, fine. So there were quite a number of recommendations, but again, people wanted to be. I will leave these recommendations that maybe I hope that this can be shared by the participants. But again, we are talking about more engagement of people living with the NCDs and looking at the rare NCDs, people linking with each other and working together, and many other things. Governments to think about to look at how TB, HIV has worked very successfully and learn from them. So I won't go into the recommendations, but I just want to mention that it's important for people living with the NCD to come together and fight for their rights as a group, and working together helps to ensure no conditions left behind in advocacy and process. So, but Mdoni, give me just 5 minutes to go through the charter. The charter is very important because the charter is being launched, has been launched this week, and the charter also involved a similar process of interviewing people. And it's the next slide, and coming up with recommendations that were able to be, to be resourceful for the global charter. There's another slide.
Is it okay, Zipporah, to finish because of time? It's 29.
Okay.
29 now.
Okay, so okay, fine. I will finish this. Let me just mention that the charter talked about again meaningful involvement of people living in the NCDs, and that there should be nothing about them without them. So that is also very important. And it talked about stigma and discrimination. People felt stigmatized and discriminated. And then also we asked people how they define themselves. They use different words: warrior, conqueror, survivor, advocate, victor. Again, how we define ourselves is very important. And issues of capacity building for people living with NCDs came up. They would like to be engaged in capacity building. They would like their skills to be built so that they can engage fully in addressing NCDs. So again, just to quote I'll just quote what Dr. Murray, when I interviewed Dr. Murray, what he said that we know that quite a number of people living with NCDs have formed patient-based organizations. We need to strengthen these organizations and work with them closely. We can monitor a number of NCDs and even do screening at the primary healthcare level. So one of the opportunities which exist for us is to increase the involvement of people living with NCDs in the management of their own conditions by strengthening a community strategy or primary healthcare, whereby we are offering that service at the community level. We involve people living with these conditions and to reach their peers. We can train a few who are their peers, or their leaders who will be able to easily reach the others, and that way we should be able to enhance services to them. This is from Dr. Murray, so we should actually be able to follow up on this as NCD Alliance. And again, people living with NCDs are willing to give their time to advocacy and creating awareness to take part in decision making. They are willing to tell their story. Therefore, we should take these opportunities and work with them to address the burden of NCDs. So I'll stop there. Sorry for taking more time. Like I said, these are 2 reports that are supposed to be summarized in 15 minutes. It's not possible, but I hope that NCD Alliance will be able to share these reports with all of you once they're ready to be shared. Thank you very much for your patience and for your time.
Wow, we need to give you half a day just to be able to go through this. And this is such amazing information. We always at times tend to sit and complain that nothing is being done, but from what you've presented, we can see quite a lot is going on, and would really want to have this available for public consumption. So I'll ask our host to kindly make those reports available, and we will, in the interest of time, we will quickly jump to our next presenter. We have a lot of questions coming in, so we will need to spend time for that. So I'll give Dr. Mary Nyamungo her chance to be able to talk to us on UHC. What is the status report? Dr. Mary Nyamungo is the founder and director of African Institute for Health and Development, which is a research NGO. Karibu sana, Dr.
Matt, just to guide me, we had only, this meeting is supposed to have ended 2 minutes ago.
Yes.
10:30. I need to be guided on how much time I have so that I can complete my presentation. I'll share the presentation with people. I think we need to honor that. So do I have 5 minutes, 3 minutes to share my thoughts, and then I can share the presentation? I don't want to keep longer than
yes, we're asking for the participants' indulgence. Could we kindly give you 5 minutes to give us an oversight, and then we will be able to share the presentation later. Thank you.
Okay, so I'm supposed to members to take you through UHC. We did an assessment. As you know, we do not have time to go through this. I've been introduced duly by Modoni, so I will not go into any details about where I come from. I think from our perspective, we've talked about UHC quite a bit, and we all are desirous of having UHC as part and parcel of our system. As we know, the country pilot tested UHC in 4 counties. Stephen has talked about it. Dr. Ali has talked about it. It was a pilot. It hasn't progressed. We know UHC is part of the Big 4 agenda, but we've had challenges implementing the UHC. The work I need to be addressing today is work that was done last year by the African Institute for Health and Development. We developed a policy brief. I'd like to ask NCD Alliance of Kenya to share that policy brief with members so that they can look at it. I think we still need to update it given the experience we've had with COVID on NCDs in this country. So what I'll do is just basically talk about the commitment the government has made and also basically ask us to keep the government accountable. If we sign off things as a country, we need to ensure that we basically adhere to those signatories, we implement what we signed off to. So that's the import of this session, that Kenya has committed to universal health coverage. What are we doing? What are we monitoring? Are we monitoring what we're supposed to be monitoring? And are we keeping the country accountable? So there's some key facts about how many people, half of the world's population don't have coverage. I think in Kenya, more than half of us, if you look at health insurance, only around 20% of Kenyans have any form of health insurance. So it means a lot of people do not have coverage for their health needs. Somebody in the chat talked about going to hospitals and not being covered, or being asked to buy medicine, which really doesn't help the situation at home. And given the poverty situation in many of our households, that becomes very difficult for communities to do. But what is UHC? It means that all individuals and communities, just a moment, let me do that. All individuals and communities receive the health services they need without suffering financial hardship. So the question we're asking ourselves, whether we are living with an NCD or not, how are we receiving the health services we need without suffering financial hardship? And the answer to this is no. On your WhatsApp, on your messages, every single day we are receiving appeals for help. We are receiving appeals for help for health services, or for health facilities, or for somebody who has passed on and was unable to pay for healthcare. So I think we still have a long way to go when it comes to that. It enables everyone to access the services that address the most significant causes of disease and death, ensures that the quality of those services is good enough to improve the health of the people who receive them. Again, there are questions around quality. And so as people living in the NCDs, as NCD Alliance, as even the ministry, and I want to thank Maria and his team, we need to be looking at what quality of services are we giving people. Achieving USC is one of the targets the nations of the world set when they adopted Sustainable Development Goals. What is not UHC? UHC does not mean free coverage for all possible health interventions, regardless of the cost, as no country can provide all services free of charge on a sustainable basis. And I think that's why somebody was asking, do we have a list of what is covered for NCDs? We need to generate that list. We need to share that list so that people know the limits of what UHC can cover. It is also not just about health financing. Remember, there's a big chunk of UHC that's supposed to go towards prevention, health technologies, health workforce, health facilities, communication. So when you talk about UHC, let's not box it into access to commodities. It also needs to talk about health facilities, prevention work, and all those things that make health system comprehensive. So let's not limit ourselves to what you get when you go to the health facility. Those are the three dimensions: universal and coverage, and then the health services themselves. What is covered? What's the quality of what is covered? I would like us to pay attention a bit to what is covered globally in terms of monitoring progress towards UHC. Should focus on two things: the proportion of our population that can access essential quality health services, and the proportion of the population that spends a large amount of household income on health. So those are the key monitoring indicators. And in terms of NCDs, the global monitoring indicators are prevention and treatment of raised blood pressure, prevention and treatment of raised blood glucose, cervical cancer screening, and tobacco non-smoking. So these are the global measurements, indicators for measuring achievements of UHC. We as a population and as stakeholders, we need to make sure that the government is accountable and is able to report to this. And so we came up with we developed a policy brief following conversations and interviews with different people, especially from the 4 counties that were involved in the pilot. As you know, there are many lessons learned from the pilot. I will not go through this, but our government said by 2020, it is envisaged that all persons in Kenya will have access to the essential services they need for their health and well-being through an explicit essential benefit package without the risk of financial catastrophe as a result by 2020. We are 2021. Is the story any different? I think this is what we need to question. The objectives of UHC in Kenya are given. I will not go through them. However, we've had some shortcomings, especially for the 4 counties. There are delayed disbursement of funds by the national government, late deliveries by KEMSA of commodities, and availability of drugs in health facilities. Therefore, you go there, you are eventually asked to pay long queues at the health facilities because services were free. UHC package was packaged as free healthcare, which if implemented can compromise sustainability. We've seen that after the pilot, really nothing is going on in those counties. Community members were not aware of the pilot period. They kept on hoping that they'll continue receiving. So that's a documented shortcoming. And what are some of our lessons learned on the need to reorient health systems towards a primary healthcare approach? Again, UHC talks about primary healthcare, prevention, but we end up spending too much time on the curative elements of this work. Need for a skilled health workforce, community ownership of the UHC program to ensure its success. Persons living with NCDs need to be in the driving seat. And the next slides, we'll be talking about some of the recommendations for people living with NCDs on what needs to happen for them to experience the real UHC, which I may not go into detail, but it's important for us to know that as a country, as a community, as individuals, we do need to own the UHC so that it can be implementable in a sustainable manner. And also just basically petition our government, putting targets like 2020 without really focusing on what it would take to meet that target is something that we need to petition. Again, these are slides on NCDs, the challenges persons with the NCDs, living with NCDs encounter. Some of these are already contained in the press release that's going to be shared with from our members here. So I will not go into detail on this. There's a lot of stigma and other things that we talk about. So quickly on some of the recommendations from the policy brief, the need for preventive and promotive aspects to address NCDs. Again, we've discussed that in some detail. Curative, that if a person with an NCD goes to a health facility, they are able to get the support they need in quality support in an environment that is conducive for their health needs. So that's one element. Rehabilitative, again, we talk a lot about after the surgery, what happens to you? Catastrophic expenses, maintenance of a healthy life beyond an operation becomes very expensive. And then Dr. Ali has talked to us, sensitized us about palliative care and survivorship. Again, this is an area that requires attention as we talk about UHC and as we move this process forward. Multi-stakeholder partnerships are important, and this should be encouraged. The key stakeholders would be the government, private sector, development partners, the media, civil society organizations, and the community, especially persons living with NCDs. So I will stop here due to time. I'll share this presentation with the NCD Alliance for them to share out with all members here. But just to note that the challenges for people who living with NCDs, the challenges to access healthcare, even people with insurance, after your threshold, you are on your own in this country. So they need to petition the government to at least implement its commitments to universal health coverage. Back to you, Muthoni, and thank you very much for your time. Thank you.
Thank you very, very much for being so short, straight to the point, and very succinct on very key agenda items on UHC. I hope we've gathered 2 or 3 key messages from your presentation. I will quickly jump into the questions that have really come in thick fast. We'll not be able to go through all of them, just a few key ones, and the rest will be answered to the persons who have asked offline after the meeting. So we have a question from Zuhura Gaki, who has asked when the UHC cover will start to function. And there's also a question from Sarah Irongo. Hi to everyone. For those living with diabetes type 2, including myself, let's emphasize on the role of low carbohydrate intake. That's a comment. There's a question, what can be done to help children and young people who are living with NCDs? How can this be prevented, especially during this time of COVID-19? And has the government put in place any consideration for children who live with NCDs in terms of diet in public schools? Most of the questions that have come in are actually about that, about UHC and children living with NCDs. Could I throw that back to the panelists? Dr. Mare, Dr. Zipporah Ali, Dr. Nyamungo.
Well, I wish Dr. Murray would respond to the ones of government. I don't know if the government has put in place any consideration for children living with NCDs in terms of diet. But I do remember that at one time, there's a time Dr. Kibaja talked about a program for NCDs in schools. I do not know if it ever picked up. I don't know if anybody from the ministry can answer that.
I'm not very sure whether we still have Dr. Murray here with us.
I guess if I can just come in, Mudhoni, it's
yes,
an issue of continued advocacy. We've seen a lot of improvement in the way we are managing NCDs since 2010, when we started agitating for just recognition of NCDs. So I'm the chair of the Advocacy ICC. We need to make this one of our agenda items, and I would want to welcome the member who posed that question into the team working on advocacy, so that we can structure this, assess what has happened, and structure an advocacy agenda around this particular issue. So please welcome. If you can give your name, number to Catherine Munaji, during our next meeting, we'll invite you so that we can have a more structured approach to addressing this in the country. Thank you.
thank you. Just maybe as a follow-up to you, there's from Kennedy, it is clear that we're pursuing the insurance-based model of UHC. Discussions should therefore shift on what the package contains. NCD screening and treatment should fall within that package. What do you have to say about that, Dr. Mary?
I think Dr. Ali talked about having pursued a conversation with NHIF, and still waiting for feedback from NHIF. And as you've seen, part of the monitoring for UHC is cancer screening. So we can advance and expand the range of screening for monitoring beyond just cervical cancer to screening for diabetes. Hypertension is supposed to be reported on anyway. Glucose levels are supposed to be reported on. So screening is evidently key to UHC monitoring indicators. So as a country, I think if we were to keep the country accountable, the national government accountable, then screening should be part and parcel of NHIF, because they have to report on that at the end of every year as we monitor our success towards the SDGs. So I think these are areas we need to really look at together as a team.
Then may I just respond to the concern from Grace, who I think it has mentioned twice about the issues of pediatrics. Yeah. And I think that is very important. I think it's very important that she has brought that on board. A lot of times we find that we forget the children. I worked in palliative care, and every time we'd go somewhere, would say, do not forget the children, because people make definitions and forget a definition specific for children. Children are not little adults, they are children. So we have actually focused on type 1 diabetes, but that doesn't necessarily mean it's just children, it's young people, it's children. I think as NCD Alliance, we are now aware that we need to focus a lot on pediatrics as well. Children do not have voices most times, and that's why they're forgotten. We need to have them to be their voices. We need to have their family members to be their voices. And even children can actually talk. A 6-year-old child can tell you about their disease, what they're going through. And so we need to maybe have a special dedication, a special focus on children as NCD Alliance. So thank you, Grace, for bringing that forward. It's something we'll pick up. Dr. Karakezi, NCD Alliance team, let's pick up the issue of pediatrics. Let's not forget the children, because the children are the future of this country. Thank you.
Thank you very much. And maybe as a follow-up on that, we'll just take one more question. There's a comment from Kiari Mwangi where they mentioned that the Ministry of Health, the Ministry of Education had proposed a structured return of sports at primary, secondary, and even tertiary colleges as part of NCD conversation to the growing youth. Is there anything that is being done to work with other Ministry of Health, like the Ministry of Education?
Yes, let me respond to that. We've had major challenges as NCD Alliance, even as the NCD ICC technical working groups. Our effort to expand membership beyond the Ministries of Health and civil society working on health are not usually very successful. We opened up our membership to agriculture, education, security, transport. They come to a meeting once and then they fizzle out. We are struggling with ensuring that we maintain a relationship with the other ministries. That continues to be a big challenge. We have a group interested in physical activity under Onywera, Professor Onywera of Kenyatta University. The COVID times are difficult. The interaction of children in schools has been limited, but I guess we need to use this time to develop a structured approach to physical activity in schools and how we interact with the Ministry of Education. As I said, we are having major issues of sustained engagement with other ministries on NCDs. We even had a conversation with the Ministry of Health regarding how do we entice them, what incentives do you use to ensure that the other ministries become part and parcel of the conversations on NCDs. That's still a big challenge. Multi-sectoral coordination on NCD is a challenge, not only in Kenya, but even globally. I serve on other committees. Just to make them engaged and become part and parcel of the conversation is very difficult. Thank you. That's the honest truth from my perspective.
And thank you for being honest. Sorry, guys, we will not be able to go through all the other questions. Oh, Dr. Mare, there you are.
Thank you. Yeah,
Yes,
sorry,
please.
I was interrupted by some few phone calls here and there, and I lost track. But
No
I
problem.
thank my colleagues, Dr. Zipporah and Dr. Mary Nyamongo, for very ably responding to some of the questions. Particularly the last question, I'm glad Dr. Mary has really approached it very technically. And maybe what I may want to add from what Mary has said is that in our NCD Prevention and Control Strategic Plan, we are envisaging to have a steering committee for NCDs under the chair of the Cabinet Secretary, Ministry of Health. And through this, we should be able to bring out other government sector with a bit of zealous or with a bit of increased energy. And we are targeting to have involvement from the level of PSCs and above, and also other UN agencies and all that in that NCD steering committee. And through this, we may be able to discuss some of those pertinent issues like physical activities in schools. But despite all that, I'm glad something is being done, but yes, too little, because we really need to put our efforts together so that we can make sure that some of these issues like physical activities at school are addressed early enough, and we can make a lot of gain while using very little resources. Thank you.
Thank you very much for coming in right on time. So in the interest of time, I will hand this meeting over to Dr. Catherine Karekezi, who is a technical advisor at NCD Alliance, to give us the way forward before we close. Karibu sana, Dr. Karekezi.
Thank you very much, Muthoni, and thank you very much, Dr. Nyamongo, Dr. Ali, Dr. Murray, and Mr. Gikonyo, and Dr. Lillian for your participation today. And thank you very much, everyone, for joining us. We've raised a lot of issues, a lot of questions that need to be answered, and I can't say that we have all the answers at this moment. But I thank Dr. Murray for his last comment about the steering committee for NCDs, and I think this is a way forward. which will enable us to bring on board the non-health sector at a high level, and therefore we'll be able to have sustainable engagement with the other sectors. As NCD Alliance, we commit the government accountable. As we have mentioned today, the government has made many commitments. There are lots of documents which we have developed which have not been implemented, and we want to see how best we can do this as we move forward. We also acknowledge what the government has done, the Ministry of Health has done in developing the new NCD strategy, and the fact that persons living with NCDs were meaningfully involved from the beginning in its development. We look forward to persons living with NCDs being involved in implementation, in monitoring, evaluating, and even holding the ministry accountable for what they have committed to do. I know we have a lot of questions about UHC, which is the big elephant in the room, together with NHIF. As Dr. Ali says, we have had engagement with the different committees, but not yet borne fruit, but this is something that we'll continue to follow on. Again, we have talked about tokenism of persons living with NCDs and the real need for us to involve persons living with NCDs in a meaningful way and ensure that we listen to the voices that are raised and we actually do something about their concerns. And lastly, we've also mentioned the issue of our children who are not all adults and the need to focus on the needs of children and adolescents and also young people who tend to be neglected, especially in the area of NCDs. Not so much neglected, but we don't have a lot of focus on these particular age groups. So I think finally, just to finish off, we have a lot to do, yes. We need to have a structured approach as we move forward. And I think a lot of issues have been raised this morning, which we need to tackle in a structured fashion. So we will, as NCD Alliance, go back and review the comments which have been made today and see how best to move forward, involving the ministry and all our stakeholders as we look forward to the way forward, even as we partner with the ministry to implement the NCD strategy. As we partnered in developing it, I believe we shall be partners in implementing it, and we will align our interventions that NCD Alliance is going to implement moving forward. Will align with the NCD strategy so that at least we're all moving in the same direction. So I think on behalf of NCD Alliance, I just want to say that accountability is key. We make commitments. Let's live up to the commitments that we make. Let's keep each other accountable as we move forward in preventing and controlling NCDs in our country, and also look at how we can meaningfully involve persons living with NCDs in everything that we do, and also consider persons living with NCDs as key partners in all that happens, and also not just focusing on disease conditions. It doesn't matter whether you're living with lupus, you're living with diabetes, or you have a mental health condition. All NCDs are important because they affect the individual. And as Dr. Zipporah Ali said, let's focus on the individual and the quality of life for each and every person. Let us look at the spectrum of NCDs, and let us look at individuals living with NCDs, not necessarily at the condition that they live with. So I think on behalf of NCD Alliance, other issues which have come up, navigation is obviously key. They need to focus on prevention and the whole spectrum, from prevention to treatment to rehabilitation, palliative care, and survivorship. So let's look at the whole spectrum where NCDs are concerned, and let's not forget the individual at the center of all the NCDs. So on behalf of NCD Alliance, I thank you for your indulgence. I know we have really overshot. I think we ended up with a very ambitious program. Thank you for joining us. We'll be sharing this, the presentations, and we will also be sharing the documents which we have developed, the CSO report, the policy brief on UHC, and also the report that we have on preparing for the Global Charter for persons living with NCDs. So on behalf of NCD Alliance, once more, thank you very much. And I wish you all a good day, keep safe, and we look forward to meeting you again the next forum that we will arrange. Thank you very much.
Thank you, Dr. Karekezi. And this has been the Global Week of Action webinar. A kind reminder that we have an active social media campaign. So please check into your social media sites and use hashtag Tuonge NCDs, hashtag Act on NCDs. On Facebook, go to NCD Alliance Kenya. On Twitter, there's @NCDAK. NCD Alliance will also be sharing the presentations, the press statements, and the videos after the meetings, and also incorporate the questions that have not been answered today. We would like to thank the panelists, Dr. Lilian Mbao, Dr. Mary Nyamungo, Dr. Ephantus Mare, Bona John Gikonyo, Dr. Catherine Karekezi, and Dr. Zipporah Ali for a very comprehensive information-heavy presentation today. We'd also like to thank the Ministry of Health on behalf of Dr. Ephantus Mare, the Global NCD Alliance, African Institute for Health and Development, the Caucus of People Living with NCDs, the civil societies, and patient-led organizations, and more especially a special mention to John Gikonyo, who has been leading the Global Week of Action planning team. As a final end note, we would like to say to Tuonge NCDs, let's do this at home, at work, in our churches and mosques, to our friends, to our families, and don't forget to leave our children. Have a productive day ahead of you. Let it be safe. Stay safe, stay productive. This has been Muthoni Mate, your moderator for today. Asanteni sana, and have a good day. Bye-bye.
Bye, thank you.
I've been in dialysis for 6 years. I've looked everywhere. MPs, MCAs, no help.
I've been living with this health condition for now it's 6 years. Yeah, I am amputated. What can I do? Nikafikiria even suicide. So depression ilikuwa imeingia.
My life changed when I found out that I had sickle cell. I had no idea what it was. I had no symptoms for the past years I had lived. I was not used to living with it.
My son is Munene and he's living with Down syndrome. Our children have ended up being left out completely, and some will say they will not disclose. So that discrimination, I will not say that my child has Down syndrome, so that he's covered.
I have been living with ulcerative colitis and a liver transplant. I'm not able to go to hospital to get my blood tests done as regularly as I would like.
I have lived
Hi, it seems the video has stopped playing. Hi, Munaji.
Stay at home, maintain the pain, and then that's it.
Access to these services means parents will go into their pocket. And will I feed my family or parent, or just use this money to treat one child? So that is quite a huge thing for caregivers with children with Down syndrome.
The medicines I'm taking, I have to take them for the rest of my life. So we've had to get them from India, because in Kenya, they're very expensive to get here, and some drugs are not even available.
I used to get my medication at a fair price, but now kind of found the prices had been hiked, and when it comes to going to see my doctor, I can't do that anymore.
I think the areas that the government inafaa kuwa involved mostly, COVID-19 committee, wapate someone living with non-communicable disease, mwenye anaweza angalia masilahi ya watu wanaishi na hizo condition.
Sickle cell, it's just like any other disease like AIDS. So AIDS patients get medicines. Let us just have free drugs for this diseases.
It would be good if the government would increase the support that NHIF offers. That would help with the drugs and the hospital visits.
Hiyo NHIF wangeiweka ikuwe inasaidia patients mpaka wanafanya transplant, full transplant, wangekuwa wamesaidia watu wengi sana.
The government should just step in. We need counseling because we need to be talked to. Yeah, we need to understand that it's going to be better.